So this week is a little bit different. We're going to kind of just do a little vlog about our infertility and IVF process.
Yeah, you guys have maybe followed along for the last 2 years as we went through our first journey through pregnancy, natural conception.
Yeah.
Went week by week through that and shared some parenting, medical advice, things like that.
Yeah.
And of course, if you missed it, kind of now as we're trying for baby 2, we've discovered we've got some secondary infertility. And so thought we might as well share this along the way and give you guys an inside look into what it looks like for a IVF physician and a reproductive endocrinologist to go through IVF with your pediatrician husband. So just in case you haven't met us before, I'm Kurt, I'm a board certified pediatrician.
I'm Sarah, I am a board certified OBGYN and also a fertility specialist.
And we are the Doctors Bjorkman.
So we thought this week we would just kind of share what we've been feeling and doing with this, trying to get pregnant again.
And then starting this IVF journey too, so.
Yeah, so this has been very unexpected, as it is for most people, you know, but especially we got very lucky the first time around and got pregnant very easily with Cease.
There was like 3 or 4 months of trying, and then, hey, we got a baby, everything's kind of well within normal.
Yeah.
And then even thought like, hey, we want to have kiddos close in age to each other. And so 6 months had passed, and we were like, hey, let's try for number 2.
Yep, let's keep this party going, and just didn't get pregnant, and wasn't pregnant, and wasn't pregnant, and wasn't pregnant, and the 2-week wait certainly sucks time and time again. And
I think going into it early, like we knew like, hey, Sarah was still breastfeeding. We thought like kind of there may be some hormonal things with that and other things that like may make it harder to get pregnant at first.
Yeah.
And so we tried a couple times, but then started to investigate like, hey, why aren't we getting pregnant?
Right.
It doesn't have anything to do with hormones or breastfeeding. Is it anything else at play? And realizing like as we're checking things off our list, like, oh, it's not this, it's not this, it's not this, it's not this.
Yep. And said, maybe in fact this is good old secondary infertility. And you know, we tried a couple months of ovulation induction with letrozole, and that didn't work. And you know, we were kind of at this crossroads of, hey, what do we want to do next? Do we want to do more letrozole and IUIs? Are we ready to move to IVF? What do we want to do next? In our investigation, kind of the only thing we found was some
mild male factor
mild abnormalities in Kurt's sperm, and we don't know if that's always been there because we didn't have a test before.
Yeah. Or like I'd had COVID.
Is that, you know, there's this studies are showing that COVID infection may
amount and motility.
Yes.
So after trying for almost a year and kind of failing some medical augmentation,
ovulation induction with letrozole, we did a few cycles of that and no dice. I've burned through a lot of pregnancy tests
and ovulation tracking and all of the things that we talked about that should
all of the things
help us get pregnant quickly. And
what did we do? I got a Mira to try that to help tracking,
which was really nice and helpful.
Yeah, that was cool. We should talk. We can I can show you how we used that. The regular old ovulation predictor strips, the ones with the smiley faces. Tried all the things. We tried all the things, and also did, you know, the letrozole. No dice, no success. And
so now we're gonna start IVF. We're gonna hopefully be able to have some embryos. So if we want to have more than 2 children, we can have
some in the freezer.
3, 4.
Yeah.
Number 8, you know.
No, thank you. But I mean, we are in our mid-30s, as Kurt said, and so having babies does not get easier as you get older. And so we said, hey, if we want more than one kid, it might not be a terrible idea if we ended up with some embryos in the freezer as well. We'll hope. Time will tell here in the next couple weeks how that goes. But it has certainly been a learning process so far.
Do you want to share maybe some of the feelings that you've had kind of going into this?
Yeah, sure. I've had a lot of feelings about doing IVF, I guess, and infertility. And one of those is like, we have been so open, and it was very easy to share everything else with our pregnancy and getting pregnant with Cease. And that was very easy and felt very natural. This has been harder. I think, I don't know if it's like some embarrassment. I don't know, that we just like haven't been able to get pregnant, and this like, I don't know. I'm a reproductive endocrinologist and infertility specialist. I know how I get people pregnant for a living. It's my job. And, despite doing everything right, infertility still exists.
Yeah, and it's funny how, like, even as we were going through our infertility workup, like, there was almost, like, as, like, things were coming back, like, oh, it's not this, it's not this. And, you like kind of it adds to like, oh, it should be this causing the infertility, and then it's not.
Yeah.
And then like, when we did my semen analysis, and like there was kind of low count and low motility, borderline numbers for that. Like it was funny that almost like it was relief for Sarah, and that like it wasn't her.
Fault. It isn't me. I thought it was me the whole time, and it wasn't.
Yeah. Which then like is a different feeling for me in terms of like, oh gosh, like we've been working and doing all of these things, and the whole time it was my semen, or like was that not it at all, and it was like that was something new that came on in the process, secondary to a COVID infection. So
yeah, I also, as an infertility doctor, I take care of patients all day who are trying to have their first baby. So I have this guilt. I have a beautiful daughter. We love her so much. We're obsessed with her. And here I am like, that's not enough. I want another baby. I'm going to do this treatment for more babies. And so there's like a little bit of guilt. And I think that is a common thing with secondary infertility, that couples in general like don't feel as much support. And it is overlooked a little bit because, again, you already have a child. And so it's just looked at a little differently. I also am like very, very aware of the privilege we have in doing this. I am an IVF doctor. I have so much access to care. I knew when we weren't getting pregnant to go seek care, to start a workup, to do these things. We had access to do that. We had insurance coverage to do that. I just have so much, I have so many resources as a physician that many women and people who struggle with infertility don't have. And so I'm just very aware of that privilege, and thankful, grateful for like where we are that we could do this.
And even like our infertility work up was probably expedited because you're able to kind of sit down and say like, oh, we need to do this, and this. And so a lot of that maybe happens without kind of waiting for that first visit, and then waiting for follow-up visits of labs and things like that have been very fortunate for us, but we'll go through and share a lot of that experience with you guys too.
Yeah. Ultimately, through all of it, I have been so grateful. I think we like the nurses I work with, the pharmacists, our embryologists, the docs around us are so great. And I think the other emotion we have is just so much hope, because we have this great team that's taking care of us, and we have a great embryology lab. And so I just like have so much faith in them. And, from the pharmacist who's amazing and sat down with me and went through how to do these meds and how to do different things, and our nurses who are just like loving on me so hard, even though I've been, their doc for so long. And it's just, there's so much gratitude, so much hope at this point, despite months and months of not being able to get pregnant. I'm hopeful. So we wanted to share that with you. We are really, truly just starting this process so you can live it with us. I have officially finished my 1 month, 3 weeks of birth control pills, which is very counterintuitive, but often that is how you start to get ready for an IVF cycle.
And that's just to time the cycle. That's the purpose of that?
It A, helps with timing, and B, like helps synchronize the cohort of follicles in your ovary, so that all of
the
those
eggs are on the same time cycle.
Yes,
Okay.
that's the goal. So we're gonna do our first injection, and
Tonight.
we'll do more videos on like how to do IVF meds and things like that, because as I said, when we're going through this, if I'm looking it up and learning about it, probably some of you out there are as well, and so we want to share and make things easy and understandable as always. And so tonight, injection 1 is Follistim. So shall we?
Yeah.
All right, so I am opening these things for the first time. Will you open that real quick?
Yep.
I had a lesson with the pharmacist on last week, just so everything's ready to go. So Follistim is a medication that helps the follicles to grow. All of these medications.
And follicles, again, are precursors for eggs, or what is
Yes, the eggs grow in the follicles.
Okay.
So, hang on to that. So, you basically are going to want to refrigerate. Follistim has these cartridges that you put in a pen. You want to keep that Follistim in the refrigerator until you are ready to put it in your pen, because it's good in the fridge basically until the expiration date on the box, which like this is 2023, November of 23.
So a year and a half from now for us. Yeah.
But once you put it in the pen, it is good for 28 days. So at room temperature, like once it's in the pen, it's good for 28 days and you can have it out at room temp. So in the Follistim box, there is this little cartridge. This is the $1 million medication.
Not literally.
Not literally, but it's very, very expensive. Very, very expensive. So the pen comes apart. You put the metal, I think, on here, like something like this. No, like this.
The way, yeah.
There is a little, it fits in here. And then you screw the pen on, I hope.
Yep.
There we go. There's a little resistance. So
we haven't practiced
We haven't practiced this. This is really first time. So you then dial up your dose on the pen until you get to the number that you need. Now, our pharmacist told me never ever put the needle on until you have the dose dialed and you're ready to go. Okay? So these needles come all prepackaged. It's very sweet in these plastic little things. Pen is dialed. Take the pen off. You're supposed to, yeah. Can you open the alcohol swab?
Sure.
You wipe this tip of the pen. We'll wipe once there. Open that bad boy. You open your needle. And then yeah, isn't this nice? You put it into the pen.
Screw on.
And screw it on. Sweet. Now, you pull the needle out and there's still a little needle protector.
Okay.
So the pen is ready to go. I'm going to clean about a 2-inch area here on my belly.
And where does the shot need to go?
Sub-Q.
Okay. What does that mean?
So in the subcutaneous tissue, aka the fat, around your belly button in this smiley face. So then you pinch.
Can we uncap it?
I want you to uncap this.
And there's a needle.
Am I really doing this? Maybe you should do this.
Totally up to you.
We're at 225. Okay. I think I can do this. Can I do this?
Yeah.
I'm afraid. So 45-degree angle. And then
You okay?
I think so.
Okay.
We're going to go in. Oh, not that bad. So we're in. We inject the medication. It clicks, clicks, clicks. You go till it's done clicking. You hold 1, 2, 3, and then you pull out.
Okay.
Okay. That was not as bad as I expected. That was fine.
Okay. What do you have to do with the needle now?
Put it back in
the
this.
bin it came. Okay.
Yeah.
Without poking yourself or your
Yep.
partner.
So carefully back in this plastic thing. Then you unscrew because we're going to dispose of this in a sharps container. That was our first injection.
First one.
It was mostly fine. What time is it? It is 8 o'clock. So you want to take your injections at the same time every night, like plus minus 30 minutes. So 8 o'clock is our time.
Yep.
Every night for the next 10 to 12 days. Here we go. We'll see you soon.
Bye, guys.
Bye. Okay, we did it. We did it.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.